I'm Larry Schlesinger, and I'm a board-certified plastic surgeon. I have offices on 3 islands: Maui, the Big Island, and of course Oahu. And today I'm going to describe for you the mommy makeover. Well, why in the world do mommies need makeovers in the first place? Well, usually mommies are young women who have attractive bodies, and then after pregnancy does some pretty nasty things to most women. Not all. Some women survive pregnancy with great looking bodies, but most need a little help afterwards, and that's what plastic surgeons are all about. Mommy makeover is a combination of surgical procedures and also some dermatologic procedures to improve the way you look after the pregnancy to get you back into the swing of things. The different areas in the mommy makeover from head to toe are the dermatologic problem of hyperpigmentation or dark pigment after you've had a pregnancy. And this is known variously as the mask of pregnancy, chloasma, or melasma. And it's a hyperpigmentation that occurs around the eyes, on the cheeks, sometimes on the upper lip. And this can be treated, and we will discuss the treatment later, but it's treated with a topical cream. The next area in the mommy makeover are breasts. Breasts very often become larger and droopier, and the droopiness gives women an older look, one that they don't particularly like. Sometimes breasts actually get bigger, but most times they deflate. There's an area in the armpit called the axillary breast tissue, which is usually breast tissue before you're 20, and after you're 20 it usually turns to fat and it looks unattractive and hangs over your bra. We get rid of that easily with liposuction. Sometimes the nipples droop down and have an unattractive tilt to them. This is easily corrected. Sometimes you need breast reduction, sometimes you need breast augmentation, sometimes a combination, and of course always the lift. We'll get into that at a later time. The next area is the abdomen. In the abdomen you have loose skin, sometimes stretch marks, usually below the umbilicus, below the belly button. You have excess tissue, fat, and you have, because your entire abdomen loosens and goes downward, your vulva or female organs also travel downward, creating certain problems for women after they've had multiple pregnancies. The next area to be discussed today is fat. Fat seems to come with pregnancy. Sometimes it's called baby fat, sometimes it's called just a pain, but fat after pregnancy occurs in the hips or love handles. It occurs above and below the bra. It occurs in the thighs and knees. And this is easily treated with liposuction. I will discuss that later as well. And the final area, which I've already alluded to, is the labia or internal lips in the vulva. Very often stretch out and hang outside of the vulva, giving very often a post-mature or not particularly good look. And the plastic surgeons have come up with an excellent way of getting rid of this excess labial tissue with no scarring and incredibly quick recovery. I'll be discussing all of that today. The first area that I plan on discussing today is dermatologic problems caused by pregnancy. The most common is a hyperpigmentation on the face, meaning dark pigment on the face, and it's known variously as the mask of pregnancy, chloasma, or melasma. And dermatologists are very good at treating this, but unfortunately there's some ideas out there that I don't agree with. People have been using bleaching cream, and the problem with bleaching cream, especially for any woman who has some pigment in her skin anyhow, like so many of us in Hawaii, you don't want to use a bleaching cream because it will give you a light area in the whole area, not just the melasma, not just the pregnancy, post-pregnancy hyperpigmentation, but it leaves you with, these bleaching creams leave you with an unnatural area of white in a darker area. So I've come up with a cream which they make up for me at Polymomi, at a pharmacy near Polymomi, and it's called, and this was not my doing but theirs, it's called Schlesinger's Melasma Cream. We're happy to give you a prescription. You can go there and pick it up, or if you want to buy it from us, it's the same price as what they sell there. So the cream is it's got kojic acid in it. It very often breaks up the hyperpigmentation, strips away the superficial layers, and we've seen great results. I'm not a dermatologist, but we use it all the time, and I've had some very, very happy patients. The next area that I'd like to discuss today are breasts. And breasts are probably the biggest and area that a plastic surgeon deals with. Post-pregnancy, some women actually get larger breasts. Not very many, but some. And when that happens, their larger breasts are both offensive to them because they're so large, and very often they're droopy. So let's define some terms. Droopy would seem to be an obvious word, but it's really not. In plastic surgery, there are several different layers or areas of droop. Droop in plastic surgery, or in medicine in general, we use the Latin word ptosis. Now the P is silent, so it's P-T-O-S-I-S. If you read it, you'd say ptosis, but no, it's ptosis.